Hi, everyone. Thank you for being here today. In November of last year, we committed to refocusing the healthcare system. And today I stand here to share that we are taking the next step in achieving this goal of an improved healthcare system for Albertans. This afternoon, I will be tabling Bill 22, the Health Statutes Amendment Act. Our province is in the midst of a transformative journey toward building a healthcare system that will not only meet the needs of Albertans today, but also pave the way for future generations to thrive. Through the Health Statutes Amendment Act, we are poised to usher in an era of efficiency, accessibility, and patient-centered care. The amendments proposed in this act are not just bureaucratic changes. They represent a fundamental shift in how we approach healthcare in Alberta. By updating legislation to enable better governance and oversight of healthcare, we are laying the foundation for a stronger, unified provincial healthcare delivery system. So this system will be organized around 4 priority sectors: primary care, acute care, continuing care, and mental health and addiction. Central to these amendments is the creation of the 4 new provincial health agencies responsible for each of these sectors. So these agencies will be responsible for delivering integrated health services, ensuring that Albertans receive timely access to care regardless of where they live. So through clear identification of roles and responsibilities, we will streamline operations, enhance accountability, and improve transparency within our healthcare system. So this will lead to improved patient care and better support for frontline healthcare workers who will work in organizations that focus on their expertise. The legislative changes will also support the transition of staff from Alberta Health Services to the new provincial health organizations. Ensuring stability is key throughout this transition. There will be no job losses for staff who transition into the new organizations, and every effort is being made to ensure that there are no interruptions to patient care or employment. Unionized employees within Alberta Health Services who are transferred to the new provincial health agencies will have their collective agreements and bargaining processes move with them. In fact, these collective agreements and processes are being confirmed through legislation to continue to apply in the same way to employees under their new employer as they do under AHS. I want healthcare workers to know we are here to support them through this whole transition and beyond it, as we utilize their expertise to shape a healthcare system that better supports them and the patients that they care for. The vision for this refocused system is ambitious, yet attainable. It is a system where every Albertan has access to a primary care provider, where acute care is swift and efficient, where continuing care options are equitable and comprehensive, and where mental health and addiction services are integrated into the fabric of care. This is the future we are working towards, a future where healthcare actually works for Albertans. Achieving this vision requires more than just legislative changes. It requires collaboration, innovation, and a commitment to excellence. The Health Statutes Amendment Act will foster a culture of collaboration and integration within our healthcare system by providing the structure that supports its success. This will help further empower frontline workers and regional partners to drive change at the local level. Enhanced government oversight will ensure that resources are directed where they are needed most, on the front lines, improving patient care and supporting our healthcare professionals. Assuming the Health Statutes Amendment Act passes, the bill will take effect in June, marking a significant milestone in our pursuit of better healthcare outcomes. Recovery Alberta, the Mental Health and Addiction Provincial Health Agency, is set to be operational this summer, with the primary care, acute care, and continuing care provincial health authorities to follow in the fall of 2024. Each of these agencies will play a crucial role in realizing our vision for a healthier Alberta. The primary care agency will ensure that every Albertan has access to a family physician or nurse practitioner, while the acute care agency will work to reduce wait times and enhance access to care, particularly in rural communities. The continuing care agency will focus on equitable access to services and the expansion of continuing care options, while Recovery Alberta will provide comprehensive mental health and addiction services across our province. Today, we are laying the groundwork to shape the refocused healthcare system. The critical improvements to transparency and accountability we are proposing in this legislation will help support the successful refocusing of the healthcare system to one that is responsive, effective, and reflects the needs and priorities of Albertans, not just for today, but for generations to come. And with that, I will turn it over to Minister Dan Williams.
Thank you, Well, good morning, or good afternoon, everyone. Very nice to see you here, and thank you, Minister, for the work you're doing. I'm very pleased to be here to support Minister LaGrange in this bill, Bill 22, that we're introducing. With Bill 22, we've reached a milestone in refocusing Alberta's healthcare system and establishing Recovery Alberta as the lead public provider of mental health and addiction services within our province. 5 years ago, we did not even have a Ministry of Mental Health and Addiction. Instead, these services were a single line item within the largest budget across government, and mental health and addiction services were left to be managed out of that department rather than receiving front and center attention they deserve, with a ministry, a budget line dedicated to it, and a minister responsible for executing. These made things difficult for families and mental health and addiction challenges. This passed and made things difficult for families searching mental health and addiction services. And increasingly, mental health and addiction challenges have become more common. Parents have often struggled to know where to find help for their children facing mental health and addiction challenges. I hear this many times in my role as an MLA for the most northern constituency in our province. Any family who has tried to support a child suffering from addiction or from mental illness would agree that we need to do better. We need to have more consistent access across the province for treatment and for resources for specific challenges families face. We are committed to making sure that these services are available to anyone facing a mental health or addiction challenge and to support them in their pursuit of recovery. This is a hopeful message that every person, every Albertan, every parent, every family, and every community across our province deserves to hear and deserves to have access to. For mental health challenges, recovery means someone can live a hopeful, fulfilled life, even when symptoms persist. A recovery from addiction is helping somebody stop or reduce the use of drugs, supporting them as they rebuild their lives to reconnect with their family, their community, and their culture. This is the focus of Recovery Alberta, the new organization that we're establishing. There are approximately 10,000 frontline staff that will be transitioning to Recovery Alberta, helping us deliver, in collaboration, support to millions of Albertans. Since our announcement last month, we have engaged with more than 1,700 staff and Albertans, each of which who are going to play a critical role in supporting Recovery Alberta and the mission we have to deliver mental health and addiction care. Through these engagements, we answered hundreds of questions, myself taking over 100 on the line with frontline workers, informing us of the challenges they face and hopes they have for the new system, and putting a focus on mental health and addiction care, making sure there is consistent access to high-quality services across our province. Staff were assured at these times that their terms and conditions of employment would remain unchanged. This includes their pay, their seniority, their vacation, their entitlement, and any other agreement established between employee and AHS. As we establish Recovery Alberta, we will be looking for opportunities to expand services to make them more consistently available across the province. This is why Albertans expect and are proud to deliver making necessary changes to build a strong system of mental health and addiction care in Recovery Alberta. We're leading our nation with our focus on recovery. And we're also supporting prevention and intervention as focuses in the Alberta recovery model. These are the announcements and policies that make a difference in Albertans' lives. and to help reunite and rebuild families who have suffered from challenges, from illnesses, from disease, whether it be a mental health or addiction. We know that every single Albertan deserves the opportunity to pursue recovery. And with that, I'll turn it over to our press secretary to lead us in questions.
All right, thanks folks. As I noted, we're a little tight on time, so if we could please keep it to one question and one follow-up, and please state your name and outlet for the record. If you're here in person, raise your hand and I'll try and go with who I saw first, and that would be Jonathan. Go ahead.
Okay. Jonathan Bradley, Western Standard. So in the Health Statutes Amendment Act, there's a section for an oversight minister and then a section minister. Why did you feel compelled to do that?
Well, because right now I am the oversight minister, and then as we develop, particularly we're looking at mental health and addictions right now. I'll give you the example. We have a sector minister. So the individual will the minister will be able to really drill down and focus all of their energies on ensuring that that sector is delivering on the priorities of that sector.
Okay, and you mentioned that the three other organizations are going to be beginning operations in the fall. What steps remain for them to become operational?
Well, many steps have to take part, and the first step is the legislation that we're passing, or going to pass. I'm hoping to pass with Bill 22. This enabling legislation really allows us to set up those organizations in their priority areas of acute care, mental health and addictions, primary care, and continuing care, and then we will make sure that all of the steps that we need to have to set them up effectively will be followed.
Thank you.
I saw Michelle next.
Sorry, excuse me. The system is suffering from a shortage of healthcare workers, including physicians and nurses. So how will these proposed changes actually remedy that situation and bring people to Alberta to work and help Albertans?
Well, running an efficient organization, making sure that the whole health care system is efficient, will obviously relieve stressors on the front lines. We continue to go through with our workforce strategies that we're implementing, whether it's the nurse practitioner program that we just made recent announcements on, and I'm happy to say that for the 50 positions that are available for nurse practitioners to function autonomously, that we've already seen 63 applications. We've had approximately 1,000 nurses apply for the 50 spots at the U of A for the nurse practitioner program. We've hired and brought in approximately, I think we're over 4,700 nurses just within the last 9 months that I've been in office, and that I know that we've also that we're continuing to attract and retain physicians, and particularly on the attraction side. We've had over 500 physicians, of which 215 are family physicians. So it will continue to be a priority to make sure that we have the workforce. But when a workforce is actually seeing results, when they're happy in their jobs, when we've refocused to the front lines, we know that we will be better able to retain them. There will be less overtime and illness and sickness, and we also know that we'll be able to attract other from other provinces and other areas to our province. Sure, absolutely.
It's a good question, and I can tell you, practically speaking, my conversations with healthcare professionals, they don't do the work they do for the money. They feel like they have a vocation where they are called to help heal individuals who are suffering. After we announced Recovery Alberta, that same weekend, we saw hundreds of individuals asking where they could apply. The culture that we want to create around recovery as a hopeful opportunity for people is already having a practical impact. And that starts with the announcement before we even come to the point of establishing as a corporation and the standing up in June and July. So we see already there's an interest from across the country of healthcare professionals, and we had, doctors, nurses, all the way down to healthcare aides and recovery coaches saying, can I be involved? So there are consequences to the way that you frame and build out your organizations, and we're hoping that this is going to be a collaborative one.
Great points, Minister Williams. And I would also add that we've had numerous engagements across this province, over 65, with over 3,000 people attending. And that is one of the key areas that I continually hear, that they want to be respected, they want their voices heard, and they want to feel that their expertise is being utilized.
As a follow-up. Okay, I mean, I take your point, but I mean, if I was a physician or a nurse, for example, where my services are, you know, in great demand, why wouldn't I go to British Columbia or even Saskatchewan, where the system is a little more stable? Like, this just seems like you're ripping apart the system and then trying to get it to mold it. So I mean, as someone who's a healthcare worker who work anywhere, why would they come here?
Well, and I'll start and then I'll turn it over to my colleague. First of all, I would say it's the opposite. We're in fact focusing the system on allowing those health professionals to do what they do best. And right now it's quite fragmented and it needs to be refocused, you know, that on so many different levels. And so that is something that we have heard over and over again as we've done our engagements across the province, that frontline workers really do want to be part of the solutions. They're excited by the possibilities. There's hope that the work that they're doing will in fact produce better results and can be, they can really use their skills to their full potential. Mr. Williams?
Yeah, I'll add that stability has been the watchword, along with continuity of the transition that I've led on my part into Recovery Alberta, and I can talk more about that later. But importantly, nurses would rather work in Alberta than British Columbia because working conditions of being forced to deal with weapons in the work site, blades, with secondhand fentanyl and crystal meth smoke in their establishments is not a safe working environment.
They could work somewhere else then. If they don't want to go to BC, they could work in Ontario, they could work in Nova Scotia, they could work in the
So the
United
example
States.
given was British Columbia, and I'm highlighting why Alberta, as contrast to British Columbia, is a very attractive place to work. Not only do we have lower cost of living, terrific work environments that respect frontline staff, we have a culture in Recovery Alberta that's about healing and helping. All this is attractive to the way that professionals think when they've spent their entire life building up expertise when it comes to healing people. That's what they're called to do, and they want to do it in a place that respects that. And that's one of the reasons I think we're going to be successful.
I had Catherine, then Brianna.
Yeah, so your department officials couldn't tell us, so what happens to public health inspectors after AHS has transitioned to its own organizations?
Well, we are currently looking at public health as a whole. It is something that we've heard very strongly through the engagements that we've done, and we will have more information on that as we continue to bring forward advancements.
So when, and like I see that this bill gives you the power to create new organizations beyond just these 4. So is that what you're looking at doing, or when will we?
No, at this point in time, we are just looking at the 4 organizations, but there's a lot of work, and we are distilling all of the information that we have been getting through the engagement sessions. And so we've received tremendous information, particularly around public health, and so we will continue to work with the information we've received.
Is Alberta still going to have public health?
I
Are we
believe
still gonna
it's
have
for,
public?
yes, we will have public health, yes.
All right, Brianna.
So
go ahead.
just to answer that question, but yes, I'm sorry.
Yeah.
I think we got off cycle. Unless that was your question, yeah.
I want to ask, you were talking about it being fragmented, it needs to be refocused, but we're going from one centralized board to potentially 4 PHAs with 4 separate boards, 4 separate priorities, 4 separate, how are we becoming more integrated? That was the whole point in 2008 of creating AHS, was making an integrated system. It seems like we're doing the opposite.
Well, the focus in 2008 was really to develop one regional health authority that was focused on acute care. But obviously, Alberta Health Services has branched into so many other areas other than acute care. When you look at it, oversees roughly about 28% of continuing care, but it holds all the contracts with all the other continuing care providers. It really is fragmented. You know, Alberta Health Services dabbles in primary care. It runs a few clinics, et cetera, but holds contracts with others. And it's just very disjointed. There is not a clear accountability structure. One of my first questions was, what is the financial health of every hospital in this province? And to not be able to get a response to that was problematic. So we really need to make sure that Alberta Health Services in particular is focused on what it should be doing best, which is providing excellent acute care services. And we know that that has not always been the case. And so we want to make sure that we're doing just that.
I'm happy to supplement as well.
I was going to ask about the timeline. I know we're short on time, so I appreciate that, but we're looking at this by the end of this year. Why the rush? This is such a large change. Why the rush?
Well, we're not rushing. We're working methodically to do what needs to be done. We have to set these organizations up. We have to set them up for success. When we announced in the fall, we said we would be doing public engagement. We've gone out, we've done that extensive public engagement. We're going to continue to engage. We originally thought we would be able to stand up the continuing care in the spring here. That has actually changed, so we're adjusting our timelines as necessary. But what we need right now is this enabling legislation so we can continue to do the work. We are going to be setting up the mental health and addictions organization here, Recovery Alberta, right away once this legislation passes. And we anticipate setting up continuing care, primary care, and acute care in the fall. And that is something that we have been stating all along, and we just need to keep going on the timelines that we've previously announced. But if we need to adjust, we're very flexible and are willing to adjust as needed.
I've got Lisa, then Shay, then Janet. Oh, Janet, go ahead then. Or sorry, Shay, go ahead. My bad.
Sure. So yeah, I'm just trying to understand it all. The reorganization sets out to create 4 new public health agencies, an integration council, the procurement secretariat, a center of recovery, and 13 groups underneath that to allow for input, as well as the creation of these new health services delivery organizations. And as Brianna mentioned, I imagine these organizations will have their own management structures. There's even some allowance in legislation to allow for new ministers to be appointed, as well as new organizations themselves. So I'm just hoping to understand how this plan actually will reduce bureaucracy and top-down decision-making, or if that's in fact still the goal.
Well, it is absolutely the goal, and it is certainly something that it's a top priority for us. When you look at the way the structure is right now, and it's nothing different than what we announced in the fall when we said we were coming forward with the 4 new organizations. Currently, the structure is all under Alberta Health Services, and this really teases out those individuals that are providing those services within Alberta Health Services and looking to put them in organizations so that they can focus their efforts in a more concerted area.
Just as a follow-up, I know there will be questions about allowing these public health agencies to enter into new agreements with entities in the healthcare system. Can you clarify if there's any flexibility for those entities to be private, or how you'll be defining those?
Well, currently, all of those entities have contracts within, as I said earlier, if we take continuing care as an example, Alberta Health Services provides roughly about 28% of continuing care, but it holds the contracts with all those other agencies, whether they're nonprofits or independents. But in the future state, under the continuing care organization, that organization will oversee all the contracts within continuing care, including the ones that exist within Alberta Health Services.
And then Janet, go ahead.
Okay, so the labor folks seem to disagree with this government's interpretation that you can do a lift and shift of several thousand employees into a new organization without modifying collective agreements. So what happens to this plan and the timeline for the plan if the labor board rules in favor of United Nurses of Alberta and says, yes, this was an unfair labor practice for you, the minister, to tell these people you're moving to a new boss?
Well, my understanding is, and first of all, just to kind of step back a bit, the government of Alberta is the employer, technically, even though they may be residing within Alberta Health Services right now, it is the government of Alberta that is the employer. My understanding from all of the legal analysis that we've had done, and even comparing it to what happened in 2008 when Alberta Health Services was first stood up, that in fact what we are putting forward in legislation will indeed do what we need it to do.
I also just wanted to touch on what you had just mentioned. Oh, sorry, no, I've lost my train of thought. What happens if a worker refuses to transfer to the new agency?
Well, there's always that opportunity for individuals to exercise their rights under the collective agreement. And if they choose not to go to a new agency, then there are provisions in place, and that will be a conversation with their current employer.
Like, would they lose their job? It's like, oh, you won't move, your job moved, so you're out of a job?
Well, that can be determined by, there'll have to be a conversation because I don't want to get into specifics when, hypotheticals at this point in time. There'd have to be, it would depend on the position, it would depend on the agency, it would depend on if there's the ability to have that person transition within another area within the current organization that they're in. So, very hypothetical.
Thank you. Marc-Antoine Douglas of Canada. So, the average wait time to have a consultation with a specialist, according to Fraser Institute, is 16.4 weeks. Then, from the consultation with a specialist to the point at which the patient receives treatment is 17.2 weeks. So my question is, at this point in the reform, I'm sure you've done the work, but what's your estimate of the waiting time at the end of the reform? Because you're doing it to improve the situation. So what the situation would look like, what can you tell Albertans at the end?
Well, I want every individual who is diagnosed to receive their treatment within the allocated clinical time frames that are put out there. That is the ideal, and that's what we're striving for, is the ideal. And in fact, hopefully we can surpass the ideal.
So you want to, but you don't have an estimate?
Well, I can't, just share right now, what our target date is. We are, in fact, working towards that ideal, and the sooner we can get there, the better. I prefer to, over-deliver and underestimate, the timeframes.
Darcy Robb,
Under
Kansas City
promise.
News. It's off topic, but Minister, I wanted to get your reaction to this Injection of Truth town hall that's scheduled in Calgary for next month. It's being organized by the UCP. Is the Alberta government aware of it? Are you aware of it? What's your response to that?
Well, I've come to know that it is a constituency association that has put this together. I'm not going to be there, and, and it was not put together by myself. I'm very focused on delivering excellent health care to all Albertans, and that is my focus.
Just as a follow-up, there's a stat on the website saying that child deaths in Alberta have increased 350% since 2020. They're implying it's due to the COVID vaccine. Where does that stat come from? Just because it is coming from UCP organizers, and do you believe that's
You would have to ask them where it comes from. That is not data that I've seen.
All right, thanks. We're going to go over to the phone. So operator, if you could please put through the first caller.
Don Brace, Calgary Herald.
I always make the point, and never forget that. Just do it again.
Hi, Don. I'm sorry, we're not hearing you.
Hello. Hello there.
Hi.
Did you give me a question?
I did not hear your question. I don't think anyone in the room heard your question.
I was out of the room complaining about not getting my question. I was going to ask you, Minister, you're sort of we've got the one ring that rules them all. How is this going to work? You're going to be the boss of all the other 4 agency heads who are, as I understand, will also be full ministers. And I guess that can be a recipe for division and competition or collaboration. How do you ensure it's the latter, and how do those power lines work?
Well, I'll be the oversight minister for health because we want to make sure that we have an integrated healthcare system where we do not end up with silos, and that is very, very important to me. Right now, the Minister of Mental Health and Addictions is Minister Williams, and the other 3 organizations that will be stood up, I will also be the sector minister of those organizations. But we just wanted to make sure in legislation that if something changes in the future, that we have the ability to do those changes.
So you are, though, going to, in the fall, create those 3 new agencies with names that we haven't heard yet, and ministers we don't know yet. That is going to happen in the fall.
That's not to say that those other organizations will have a different sector minister than the oversight minister. Right now, the oversight minister and the sector minister can be one and the same. And when those areas like continuing care, primary care and acute care are stood up, they will have CEOs, but the rest will be determined.
I'm just going to supplement quickly. Don, this isn't a foreign arrangement. Government all the time with the designation regs in cabinet allocates certain parts of legislation to be have authority over it by different ministers. For example, the current act, Minister LaGrange and I both share authority over Section 8, for example. We work collaboratively as one government. This is not going to cause a rift. In fact, this is an opportunity for collaboration to make sure that we're not missing anything and every minister is at the table. What we're doing is formalizing it in this legislation.
Thank you, Minister Williams. And really it is about creating those authentic wraparound services and putting the patient at the center of the care.
All right, operator, could you please put through our next caller?
Jacqueline Carmichael, Edmonton Journal. Thank you. Can you hear me?
Yes.
Okay, great. So if I was looking at your chart, we have, I'm gonna, I hear an echo. Do you guys hear an echo?
A little bit, yes.
We can hear you.
But we can hear you.
All right. Okay, so I'll go on here. Okay, so the Premier oversees the Health Minister. The Health Minister oversees acute care, primary care, and continuing care. And where does the Alberta Chief Health Officer fit in on the org chart?
Well,
That's
the chief,
my first question.
actually, the Chief Medical Officer of Health resides under Alberta Health, which is in my ministry currently. Yep. So that's where the Chief Medical Officer of Health currently resides, and that's where he will continue to reside.
Okay. Under the Progressive Conservative and the NDP government, the official opposition had embargo privileges. This stopped in 2019. Why the secrecy?
I'm not sure what your question is. Can you please expand on it?
Yes, why doesn't the official opposition have embargo privileges and access to the embargoed material and these briefings?
They are actually getting their own technical embargoed briefing as we speak, or very shortly. Yep. Before the legislation comes out, they will have had their own technical briefing, because as you can see, it's a very complex piece of legislation, and we wanted to make sure that we could answer all their questions, and they too are embargoed until it is tabled.
All right, thank you. I think that's all the time we had for today. So thanks, folks. Thanks for coming out.
Thanks, everyone.